Hi there, this is Connie Welch with LifeBeyondHepatitisC.com. This is week 17 of my post-treatment for hepatitis C. Just wanted to give you an update on how things are going. But first I wanted to give you a recap. This last April of 2012, I began the new triple therapy treatment with the new protease inhibitor Incivek, which is also called Telaprovar, along with PEG interferon and ribavirin. I was able to do treatment in 6 months and finished in September of 2012. And during treatment, I had received 4 consecutive non-detected virus loads. So that was very good. A month after treatment was completed, I did another non-detected virus load count. And then here just recently, in January of 2013, I have received my 3 to 4 month post-treatment test, and I received a non-detected virus load count as well. So that makes 6 total non-detected virus load counts. So we just couldn't be happier with the results from this test. And this, actually it was yesterday, I went to see my liver specialist and just had a wonderful report. All of my other blood work has gone back into normal limits. My red and my white blood count has come all back up. My liver enzymes are actually in low normal limits, which is excellent. My ALT and my AST are very low, and we couldn't be happier about that. The only thing that was still off somewhat is my thyroid, which the doctor said we're still tweaking that, and probably once I get a little closer to the 6-month post-treatment mark, that will either even itself out or we'll go ahead and change the dose. But it's not even off a lot, it's just off somewhat. So everything has improved, and it's continued to improve. And I wanted to talk to you about some of the after-treatment side effects that I discussed in my last video, and wanted to report that I'm sleeping well, my appetite is back, the nagging cough that I had was gone, again, the blood work has improved, I'm getting new hair growth back. The thyroid, like I said, is off still just a little bit, but that is improving. All the blood work has improved, but the biggest difference has been my fatigue and energy level. That has actually improved. My energy has improved so much. When I last reported, I'd said that my energy level had really kind of plateaued, and I was trying to, deal with that. I had been starting some physical therapy exercise for a lower back issue that I've got. My doctor had prescribed that I do physical therapy for a number of weeks, and the physical therapist was really taking me through a lot of stretching, flexibility exercises, along with some resistance training, and I've been doing that 3 times a week. But that's been wonderful. That has actually helped me break that plateau cycle. And so now my energy level has even risen. So it is so much better and improved. So I couldn't be more pleased with that. So the doctor was very pleased as well. So all of that is continuing to improve, and we're just progressing forward. But my specialist wanted to make sure that I had my flu shot, the pneumonia and the shingles vaccines up to date, because we are in a very bad flu season, and he wanted to make sure that I was well protected. So if you haven't got those vaccinations, I would strongly urge you to do that, because that will just help enforce a greater protection for you. But we're just moving on, and that was good. He had told me at this point that my blood work is looking so good. We will continue with all of the blood work every 3 months for this year. But since I'm doing so well, he won't need to see me for an actual physical checkup till I get to that 6-month mark, which will be in April. And one of the big things that we discussed was that I could now get off of the antidepressant that he had prescribed for me while I was on treatment. And I was just, really thanking God for this medication because it helped me so much. Since I've done treatment 2 other times in the past and did it without taking anything, I could see such a huge difference this time in when I was able to take something that helped alleviate the depression and anxiety and irritability, a lot of those mood swings that you get because of the treatment drugs are so strong. You think you can handle it, but this is nothing mentally or emotionally that you can handle, because this is a chemical reaction from the treatment drugs, and they are so strong. So I was very glad that I took my doctor's advice and took something while I was on treatment. But that has served its purpose. So now it's time to get off of that, but he advises not to get off cold turkey. So he advised me to step down. So I'm taking 1 every other day. And then in a few weeks, we'll start phasing that down even more. So within the next couple of months, I'll be off of that completely. And again, just very grateful that that was available. So if you're dealing with those issues, if you're on treatment, please talk to your doctor. It takes about 3 weeks for you to start taking something for it to get in your system, so you'll start seeing a difference. But there is help for you. So don't be silent about it. Talk to your doctor about it and see if there's something there for you to take to help with those symptoms. The other thing was that the doctor gave me a thumbs up for an okay for me to do the liver walk that is sponsored by the American Liver Foundation, and I'm so excited about that. The next liver walk that's going to be held here in Texas will be in April 27th, I believe. So I'm very excited about that. That'll be a wonderful goal for me to reach. And April's a very special month for me because that will commemorate a year from when I actually started treatment last year. And it will also be my 6-month mark for post-treatment. And I will also have received all my other blood work and checkup by that point. So I'll have that news as well. So April's just a really good, wonderful month for me. And it's a good goal to be working toward. So I'm very excited about that. So if any of you out there want to come to Texas and do the liver walk, just give me a shout out on my website and we can meet up. But if you're looking for a liver walk in your state or your area, just go on the American Liver Foundation website and you'll be able to see the information there and to look up where one will be held in your area. But, I'm very excited and very happy because I'll be able to participate this year in that, not only as a Hep C warrior, but as a survivor and conqueror. And you can too. And I'm just very excited that this is coming up. Well, I wanted to tell you that I am excited about the website that we have, the lifebeyondhepatitisc.com. Continues to grow, and we are actually highlighting and featuring other Hep C warriors and other treatment experiences as well as my own. So I encourage you, especially if you're seeking out information to do treatment, or if you're on treatment, or perhaps looking for a family member, check out the website. We've got a lot of medical resource information. There is a lot of support help there, as well as Christian devotionals written specifically for people who have Hep C and are going through treatment, as well as any other chronic illness. So I hope that you will check it out. If you would like to ask me any question, or if you would like to, if you need information, or to send me a prayer request, just contact me through the website, and I'd be happy to help in whatever way I can. And I just want to encourage you, if you are a Hep C warrior, to hang in there. There is real hope for this treatment and for this disease to be eradicated. There's been such an improvement from way back when all they had was interferon, and then they came out with interferon and ribavirin. Now they've come out with the triple therapy, and it works completely different than the old treatment. And we even know right now there's new trials going on for new drugs that are interferon free. And there's other research trials going on as well. So they are working, they are in the process of doing proactive things to help just eradicate this disease. So hang in there, and just know that you are a Hep C warrior. Be God-focused instead of giant-focused, because you are a giant killer, and there is real hope. Well, that's about all I have for this time. Please stay tuned for the next video update, and I hope you have a very blessed and healthy week, and God bless. Bye-bye.